Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about the radicular cyst. It's an odontogenic cyst. Classification of cyst was already discussed. I'll share the link. Okay, then let's begin the video. Now, first of all, what is radicular cyst? So it is a most common type of jaw cyst you can see in daily routine practice, always found in association with non-vital tooth or grossly decayed tooth. So basically they are of three types. So we have a three types of radicular cyst. First one, we have a periapical. As you can see, it is found at the apex. Then second one, we have a lateral, which is found along the side of the tooth root. Then the third one is the residual. So it persists in the tooth extraction socket following tooth removal, as you can see in the figure. So all these classification are based upon their location in relation to the tooth. We have a clinical features of radicular cyst. One of the very important clinical feature and most frequently asked question in NEET: eggshell like cracking. What it means? Eggshell like cracking. So if you're going to press a cyst, you can feel a cracking sensation, and this cracking sensation is due to bone resorption. As the bone resorption advances, you can feel eggshell like cracking sensation of the bone around the cyst. Very important point: if cyst is large, it may causes the displacement and resorption of the adjacent root. As you can see in the figure, due to enlargement of the cyst, the root of the adjacent tooth start resorbing. So you should take the treatment as soon as possible. We have a radiographic features, very important. As you can see, this is we have a cyst, and you can notice it's a unilocular radiolucency, well rounded unilocular radiolucency. It's not multilocular, it's a single radiolucency, and that is why it is called unilocular. And the second thing is, it's a well defined outline. As you can see in the figure, it have a well defined outline. It is not irregular in shape, have a well defined outline. And yeah, don't confuse with periapical granuloma. Periapical granuloma is different and the radicular cyst is different. How you will differentiating from periapical granuloma? So look at the figure. In first figure we have a radicular cyst and the second figure is of granuloma. So in first figure you can see a well rounded shape cyst, but in the second figure it's in irregular shape. Then in first you can see a well corticated border, but in granuloma their border is not corticated, it's irregular, you cannot feel any cortex. And cyst is always greater than 2 mm in size, and granuloma is less than 2 mm in size. Now you can differentiate between the periapical granuloma and the radicular cyst. Now histological features. So first one, we have a cystic lumen, then we have a epithelial lining, and the last one we have a fibrous capsule. So in epithelial lining you can see a rust and hyaline bodies. Very important point from a NEET examination point of view, they can ask. And in fibrous capsule you can see a large cholesterol clefts. Their cholesterol clefts are the empty clefts, so you can see a large cholesterol clefts. Now the management part. First one, go for dental extraction, because most of the radicular cyst tends to develop in a poor dental attendees. It means tooth which is grossly decayed. So you have to go for extraction because it is unrestorable. Then go for endodontic treatment if possible. And the third option is either extraction or endodontic treatment followed by enucleation. Because in some cases, if you do a extraction or an endodontic treatment, still cyst is not shrink, it will remain there. In such cases you have to go for enucleation, otherwise it may lead to development of residual cyst. I hope this video is helpful for you to understand what is radicular cyst, and if you want to know more about the other type of cyst, do comment on comment section. I'll try to make it as simple as possible. And yeah, don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest update.